Hi Victoria, how
Hi.
are you?
Good, thank you, a bit nervous.
That's very normal. I understand this is the first time you're going to have such treatment done?
Yeah.
And you have thought of this quite a long time.
Yeah, it's been bothering me for a while.
What is it that you actually want to achieve today?
Basically, my upper lip is much smaller than my bottom lip, so I just want to balance them out and just so it looks a bit better from my profile.
From the profile, your upper lip is quite flat, and it's nice to have a little bit ski slope effect there to get it a bit poutier.
Yeah, it's exactly what I'm after, to balance it out a bit.
You have a very lovely symmetrical upper lip though, so the only thing you need is a bit more volume.
That sounds good.
And to define the lip line will be absolutely enough to do to make them match, because your lower lip is absolutely full enough naturally, I think.
Okay, sounds good.
What about your medical history background? Do you have any allergies, any medication you're taking that I need to know of?
No.
No?
No. I was just wondering if it hurts.
Not at all. We have very, very good topical anesthetical gels that we put on, and I usually place it on your treatment area about 20 to 30 minutes before the treatment, and you shouldn't feel anything at all. I usually do advise that you shouldn't manipulate the area. You should ideally relax that day, not plan anything very important, because there may be some bruising and swelling. I usually put on some ice packs afterwards, and it varies very much from person to person how much you swell, and not everybody will bruise, but there is a possibility. So no important things to be booked the next coming days. Ideally, I do advise 1 to 2 weeks before any important occasion. So you should try not to book in anything very important the next coming 2 weeks, just to be on the safe side.
What is it you'll actually be putting in my lips?
It's called a hyaluronic acid gel, and it consists of a very purified kind of gel that is made up in the laboratory under very controlled conditions, but it is extremely similar to what we naturally have in our bodies, and you will find that you won't feel any lumps and bumps afterwards. It integrates with your tissues and it plumps the area that you want plumped, and it lasts between 9 to 12 months. It varies from person to person how quickly it disappears from the body. But it is very well studied and proven. It has been used since 1996, the first product that came out on the market. There are a lot of hyaluronic acid fillers out on the market. I prefer to use the one that is used the longest and is the most well proven. So Victoria, I know you said you have been thinking this through quite a long time, but I don't want to push you to make the final decision today about having the treatment. So I wish you reading through a consent form for treatment, having a look at it, and then you can go home and have a think through all of it and give me a ring when you've decided that you want to go ahead, if you do want to do so.
I'm very happy to go ahead of it today, actually. I feel, after everything you've said, I'm in really safe hands.
Okay, so
if I could just
in that
have a
case,
read.
that's absolutely fine. You can have a read, and if you're happy with that, sign at the bottom.
It's been 2 hours since my treatment finished, and I'm not in any pain. It's just slightly swollen, as you can see. The treatment went well. It went by really quickly. The needle itself just felt like tiny little pinches, but you couldn't actually feel anything significant, hardly any pain at all. I felt slightly anxious at the beginning, but the nerves quickly wore off, and by the end I was very relaxed. Yeah, I'm really happy with the shape. It looks really symmetrical and even, so I can't wait to see what they look like once the swelling's gone down.